A 7-year-old boy presents to the clinic with his mother, who notes that the way in which he plays and the way he has been limping, favoring his left leg. When asked, the patient states that his left knee hurts. He is afebrile and vital signs are stable. The patient is well nourished and meeting all developmental milestones. On physical exam, the knee has full range of motion. However, passive motion elicits pain in the left hip. An X-ray is performed and reveals a flattened left femoral head. Which of the following is the most likely diagnosis? Septic arthritis, rickets, osteopetrosis, leg calcium disease, Osgood-Schlatter disease, or its slipped capital femoral epiphysis. So here they are asking about what is the most likely diagnosis. So what is happening in this question? The patient is presenting with knee pain and altered gait. The correct answer is Perthes disease here. What is Perthes disease? Basically, Perthes disease is an avascular necrosis of the femoral head. So patients usually present with this antalgic gait, which is so they don't give as much pressure or weight on the affected leg, so that it will not be as much painful for them. And this is important to diagnose because here the X-ray finding is given of a flattened femoral head, but sometimes very early in the disease, the X-ray is usually normal too. It can be normal. So it is important to diagnose this. And the treatment here is to avoid bearing weight on the affected leg, give rest to that so that the femur head will again properly establish within the acetabulum. And sometimes if this doesn't help, then the ultimate treatment here is surgery. So this is the diagnosis. So what happens sometimes is, even though the pathology is in the hip joint, but there is a pain, patients present with knee pain, that is the referred pain to the knee. But like they say in the question, the knee has a full range of motion, meaning there is no pathology within the knee. The knee is normal, but it is the referred pain from the hip to the knee with which the patient presents. Okay. What about the other options? Septic arthritis. Um, Septic arthritis patients usually present with fever, and on local exam, there is redness and tenderness to the joint. You can see that there's something abnormal within the joint. There's fever. So it is not septic arthritis here. Rickets. Rickets patients present with generalized bone pain and all of those typical exam findings of rheumatic rosary, and the X-ray is also not of flattened femoral head. They have typical X-ray findings. They have bow knees. Their legs are like this, pointing outwards, like Genuvarus, sorry, and they have pain all over in both the legs and everywhere. It's not one particular area. It's not localized pain. What about Osgood-Schlatter disease? Patients have pain on the knee. That is, the pain is localized to a particular point on the knee, where if you press, there is tenderness. That is the Osgood-Schlatter disease, which is not seen here. And a lot of you thought that this was slipped capital femoral epiphysis. I have pictures of X-ray which will differentiate it, but slipped capital femoral epiphysis is where there is slippage, literally, like we'll see in the X-ray, there'll be slipping of the femoral head from the rest of the bone. And remember, in questions, slipped capital femoral epiphysis is usually seen in adolescents, and that too, those who are obese adolescents. So that's classical picture, and they'll give the relevant X-ray findings, or this is seen in those heavy adolescents. So let's take a look at the X-rays. Here, this is the flattening of the femoral head. This is classically avascular necrosis of Perthes disease. And over here, you see this is normal. This is a complete normal rounded femoral head as it should be, whereas this is the flattening of femoral head here. Okay. And this is the slipped carpal femoral epiphysis that I was talking about. Do you see here the femoral head? It has slipped down. This is literally, classically, it's called the ice cream cone deformity, where the ice cream is falling off the cone, right? This is the X-ray of, and it is different. Okay. This is also an X-ray of slipped carpal. And you see how it is different here, avascular necrosis, where is necrosis and improper shape of the femoral head.
Thanks for watching. Please give a thumbs up and subscribe for more.